Hi guys! I wanted to do a follow-up video on tips on breastfeeding only because my previous video didn't include a lot of practical tips, and I do have some practical tips, so here goes. I would say that if you are a first-time breastfeeding mom, or even if it's your second or third time and each baby is different and you're finding yourself struggling a bit, there are a few things you can do. Number one, I always recommend getting a really good nursing pillow. I've always stood by the Boppy. I find that it holds its shape, it's a nice sturdy size, and it conforms to your body very well. And I've been a lot bigger and used the Boppy, and I've been a lot smaller in frame and used the Boppy, and I find that it works great. It also can be used as your baby grows, so you can use it when your baby's sitting upright as sort of like a back support so they don't fall backwards. And it can also be used in the early stages, 0 to 3 months, when they're starting to practice tummy time. You can sort of like, prop them up on the Boppy. So I find it's great for those uses. The other two nursing pillows that are really hot and receive rave reviews always are the Breast Friend and also the Gia Simplisse, spelled G-I-A. Simplisse. The Gia Simplisse, I've been curious to try it because it kind of has a slope to it so that your baby's head is a little bit, I guess, higher than the rest of its body, and that's great because sometimes, depending on your position, your baby can get too much milk in their mouth and they can sort of cough, and maybe the Gia Simplisse is beneficial that way. But I've always found the Boppy to be sturdy, it's soft enough and big enough, and it works great for me. So posture is key. You're going to be nursing a lot, so you don't want it to be at the expense of your back and for you to experience any pain and for your posture to be compromised. So you want to sit in as upright position as possible. You're going to have to try out different chairs in your home to see what works best. And once you find that comfortable seating spot, sometimes what works is putting a stool bench or even a few phone books, a couple phone books, let's say, under your feet so that your knees are like a little higher up, and that way you can sort of sit back in your chair and feel very upright, and that takes away any strain on your shoulders and neck and back. For tips on latching, I have always used what's called the flipple nipple technique, and Dr. Jack Newman, you can Google him, Jack Newman breastfeeding. He has a lot of articles and videos that you can find online, and he talks about the flipple nipple technique. And I have larger size breasts, and I had flat nipples, and I had big nipples for my babies, so I find it works best for me. And so basically it's a method where you're sort of holding your boobie, and then you use your thumb sort of like on the outside of your areola, and you kind of like pull it back so that your nipple kind of turns away from your child's mouth, right? And then when they gape open wide, you kind of like flick it into their mouth so that it shoots to the top back roof of their mouth. So if you can imagine, you're gonna like hold your boob, you're gonna pull like this on your areola so that the nipple moves away from the kid's mouth, your baby's mouth, the kid's mouth, and then when they finally do their big lower jaw extended, big open mouth, then you're gonna flick it in so that their bottom lip is like at the bottom of your areola, and then you want to get as much of that areola into their mouth as possible, so you're gonna flick the nipple, and then they'll like suck it in, and it'll go really nice and deep. So if that sort of makes sense. But Dr. Jack Newman, Google him, watch the videos, he talks about it at length, and it's always worked for me. And also, if you have larger size breasts, using the football hold is great. And he also talks about that. I would show you guys, I just don't want to expose my boobies on YouTube. Maybe I'll use a balloon or something and show you guys the technique, sort of. So in terms of latching, definitely look at videos. I don't find pictures help a lot. YouTube videos, Jack Newman videos, and maybe, you know, go to La Leche League. That's obviously the most popular one. Maybe you can get someone to come in and physically help you do that. But you want to have as little distraction as possible. So in my previous video where I talked about getting all kinds of worry and distraction out of your head, this is what I'm talking about. Don't look at the clock. Don't look at the diapers. Don't look at, I don't know, what else do they say to look at? Which side you're feeding on and blah, blah, blah. Just focus on the nursing. Focus on your posture. Focus on having a nice, calm baby, skin to skin at the beginning for the newborn. And just work on the latch, work on the latch. Don't worry about the time and all of that. That'll come. It's going to happen naturally anyways. There are a few Galactogogues that you can use, and this is to promote a better milk supply. I have 3 teas that I have been using, that I have used in the past and I'm currently using. They all pretty much have similar ingredients. Some are a little more concentrated in flavor than the others, but on the whole they kind of have that sort of, that, you know, fennel. Did I just show some? Ooh, maybe. Oops. They kind of have that fennel taste, that licorice-y kind of taste. So here's one. This is called Milkmaid tea. And you've got your fennel, you've got fenugreek, red raspberry leaf, nettle, milk thistle, anise caraway, alfalfa, a few other things. So, you know, the big ones there, fenugreek, fennel, caraway. And then you've got this one here, which is the, let's get a little focus there, the Weleda nursing tea. I love Weleda products. I use their shampoos, their body washes, their, you know, all kinds of different tinctures, ointments. So the tea is still wrapped up. This is one that I have only used once before. And so I want to try it again. But again, let's see, ingredients. Where are you, ingredients? Fenugreek, anise, caraway, fennel seed, lemon verbena. The third one that I've used a lot of and that I like the most is this Lunar Eclipse. Lunar Eclipse, Lunar Nursing Tea, and fennel seeds, red raspberry leaves, nettle, dill, anise, orange peel, Chinese star anise, cinnamon bark. You get the picture. None of these are terribly cheap. My mom, what she does is she grinds up the fennel and the fenugreek and the anise. She grinds it up into, it's almost like the consistency of ground coffee, and she would make me just take a spoonful of that and chew. It's kind of like chewing sand, and, you know, chase it down with water. It's kind of gross, but it does work. But I like the teas, and usually they all recommend having 3 to 4 cups a day, steeping for about, you know, 10 to 15 minutes per cup. You kind of sweat that licorice-y smell and taste after a while of drinking it. It's not repulsive at all. I like it. I like the taste. But it does help with promoting your milk supply. And it also takes away some of the gaseous properties in your milk. Difficult to explain, but it sort of makes your milk more digestible for your baby. So you'll find that they'll have an easier time voiding, sort of expelling and doing their poops, and, you know, and having less gas, etc. So as far as Galactogogues go, those are great. I've also heard that beer helps. A friend of mine once took non-alcoholic beer, and she said that works great. I find oatmeal works wonders. I have it every morning if I can. It's healthy and it gives you that fiber, so makes your milk a lot more digestible again, and I find it helps promote milk supply. So you're nursing your baby, you're in a comfortable position, latch is going well, you're done nursing, burp your baby, and here's my little monkey here. Oh. You might not always get a burp out, so don't be worried, because children and babies who are breastfed, their latch is so nice and snug. It's not like a bottle where there might be air pockets and for them to swallow air as readily. So you might get a burp out, you might not, but give it a shot. Let them sort of like get it down into their little bellies. Offer them the other side. And the thing about nursing is it's going to be different every time, especially in the newborn phase. Sometimes you feel like you're nursing round the clock, and this is normal. Totally, totally normal. If you change a wet diaper, if you see your baby's pooping, believe me, the baby's getting enough milk. You don't have to worry about extreme weight gain and is my baby getting enough? Get that worry out of your head. I promise you, your body is producing enough. Your body is going to give your baby exactly the amount of milk that he or she needs, and you do not have to resort to formula. So please, please avoid the bottle, avoid the binkies, the pacifiers. Avoid all those things, because it's only going to confuse your baby's latch, and you'll find that if you start introducing them, your baby only needs to open up his mouth like this much in order to get the bottle in, if even. You can just sort of slip it in. And once they get used to that, they're not going to give you that big, gaping open mouth for getting a proper latch. So to unteach them that, to unlearn that, will take, maybe 24 to 48 hours of refusing the bottle, and then that's just painful for both of you, because your baby's then crying and hungry, and you're just going to give in anyways. So avoid it at all costs. Don't listen to people who say that, I don't think they're getting enough, or breastfeeding isn't plentiful enough. So see, I didn't get a burp out. She's still a little fussy, so I'm going to offer her the other side and see how it goes. And I also recommend getting a nice nursing cover, because you're going to be out and about, and you want to be able to nurse wherever you are. And that's one of the joys and benefits, I think, of nursing, that you can just, dish it out for them wherever you are. And this is just a receiving blanket now, but I do have a nice nursing cover. It's from a company called Bebeaulait, Bebeaulait, all separate words, or Hooter Hiders is the other sort of brand logo that they go by. Don't know why there's a difference there, but they have beautiful covers that have the sort of like wiring. I think it's like plastic or some sort of wiring, so it gapes here at the front, so you can look down and see your baby. It's really nice and big. It has sort of like a hoop that goes over your neck, and it also has a little cloth bib, like a terry cloth bib, on the inside of the cover in one of the corners. So that's a nice little added feature to it. Nursing laying down is the way that I like to nurse through the night. With my other two kids, I co-slept with her. I'm trying not to so much, so what I'll do is in the middle of the night, wake up with her. I have a spot that I lay out in the middle of the night. I'll nurse her, and I'll lay down and nurse her just because I'm tired and it's more comfortable for me. And when she's asleep, I'll put her back in her crib. So that's what I've been trying to do. it's hard to not get into the co-sleeping. I don't want to say trap. I love it. I did love it with my other two, and I'd love to do it with her. It's just that